The trouble for many Health Choice users began when their insurance provider contracted with EDS to begin processing its claims late last year. EDS acknowledges there were problems with the switchover, but a spokesman for the company says EDS will meet its performance targets to have the backlog of claims cleared by midsummer.
In the last 6 months, we have processed more than 1.8 million claims. That's 50% more claims than the previous vendor in the same type of time period. We put more than $280 million in payments in providers' hands.
An executive for EDS spoke about the progress during a meeting of the Oklahoma State Employees and Educators Group Insurance Board today. State Insurance Commissioner Kim Holland questioned the company about reports of a high rate of errors in processing those claims.
As you're very aware, Madam Commissioner, as things push through with the volume we had, errors are made, unfortunately.
OCGIB Administrator Bill Crane defended EDS's speed in reducing the backlog and says the number of errors is comparatively low.
That 1% in the universe is a small percentage, but it's still a lot of claims. And if it's my claim, it's 100%.
We spoke with a state employee Monday who says he was seeing a high number of those errors in the form of coding mistakes on his claims. Cleveland County Prosecutor Brady Henderson blamed those coding errors on Health Choice's claims processing company EDS, which Henderson said all financially favored Health Choice.
That is absolutely untrue. We do not handle that. That is done by the provider. Neither First Health Choice nor EDS does anything with that.
Insurance Commissioner Holland has been critical of EDS's performance, saying any delay in paying claims can have dire consequences for patients and healthcare providers, especially in rural parts of Oklahoma where cash flow is critical.
So when we make a mistake, when there is a mistake in the plan, that means that our communities suffer. And that's the thing that this board and the Health Choice organization has been really concerned about, because we did our due diligence to make a very careful choice of vendors, and it just has not gone smoothly, as everyone knows.
Holland says the number of people that claims must pass through before they are processed is evidence of the inefficiency of the current healthcare system. She points out that the U.S. leads the world in life-saving medical technology.
But when it comes to information technology, I mean, there's not an industry out there, really, that doesn't rely on email and in the internet for the sharing of information, except the medical community. I mean, we are not where we need to be.
Holland says this system drives up healthcare costs with its complexity. As for EDS, their spokesman argues that company processes claims far more cheaply than their nearest competitor. In Oklahoma City, Lori Rasmussen, the Oklahoma News Report.